Hello, everyone, and welcome to McGill Cares, a webcast series supporting family and informal caregivers. I'm Claire Webster, a former caregiver, certified dementia care consultant, and founder of McGill University's Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee the program, who include Dr. José A from the Division of Geriatric Medicine, Dr. Serge Gauthier, Professor Emeritus, and the former director of the McGill University Research Center for Studies in Aging, and Dr. Pedro Rosa-Neto, the current director of the McGill University Research Center for Studies in Aging. These webcasts are made possible thanks to the generosity of our donors. Today, I'm extremely excited with our McGill Cares episode, which we will be featuring the highlights of the World Alzheimer Report on the journey through the diagnosis of dementia that had its international launch yesterday. To discuss the findings of this report, we are accompanied by Chris Lynch, Alzheimer's Disease International's Deputy CEO and Director of Policy, Communications, and Publications. And we are surrounded by us as the co-authors of this report. Welcome, Chris.
Thank you, Claire. Absolutely delighted to be joining you today from London in the UK to talk about the World Alzheimer Report, which we launched, as Claire said yesterday, the journey through the diagnosis of dementia.
So, Chris, before we begin talking about, the 2021 World Alzheimer's Report, please tell us a bit about Alzheimer's Disease International and your organization.
Thanks, Claire. I will do. So Alzheimer's Disease International, or abbreviated to ADI, was established in 1984, and Canada was actually one of the four founding organizations of what has become now an international body. Basically, we were founded to give a voice, a global voice, to Alzheimer's disease and dementia. And jump forward to 2021, and we have 105 full members. That's associations and federations in 105 countries. We've got 20 more in our membership development program as well. So perhaps the most important thing in coming together to form this global alliance was to be able to influence at World Health Organization and the United Nations level. And we were successfully able to do that once we reached around 50 associations in number. And ever since then, we've had official representation with World Health Organization. It's particularly poignant, and I'll touch on it a little bit later as well, because dementia now has our global action plan on dementia, and governments all over the world are supposed to be working towards that global plan. In addition to that, we are the promoters of World Alzheimer's Month, of which we are currently in the middle, which is the Global Awareness Raising Month. And we're also the publisher of the World Alzheimer Report, which Claire has very kindly invited me here today to talk about in a little bit more detail. And on a day-to-day level, we produce lots and lots of support resources, particularly for people living with dementia and their carers, but also for researchers and academics and for policymakers and for scientists and anybody really that is working in the dementia and the Alzheimer's sector. If I could take a moment to direct you to our website, the resources are all available free on the website, particularly very, very good resources in terms of redirection to national Alzheimer and dementia associations. The Canadian Society and other operators in Canada are really strong. They've got excellent resources themselves. But as a global body, we are the ones that bring all of those together. They are all free as well. So please do spend 5 minutes. When you have chance, go and have a look at the website. Claire,
can you give us your website address, please?
Yes, of course. So www, and it's alzint, alzint.org, www.alzint.org.
And we will have a link to, which we currently do, under the resource section at the McGill Dementia Education website, so you can access that easily. So Chris, before we begin talking about the contents of the World Report, how symbolic is this report on an international level? And also maybe you can explain, because McGill University, what an honor for us to be leading this year's report as well as next year's report. What was the process, if you could explain to people?
Of course. So ADI have been producing World Alzheimer reports for just over a decade. They are exceptionally important documents in influencing global policy, influencing governments to change behavior, to improve preparedness, to improve readiness, etc. When we looked at generating what is currently the report we launched yesterday, this report on diagnosis, initially when we approached McGill, we were going to do this as a joint report with post-diagnosis support as well, and realized this is such a big topic. It's such a big subject area that genuinely it needed two separate global reports, two world reports on this. So to get to the point of launch yesterday has taken us a year of exceptionally close and detailed work with the McGill team, and it's been an absolute honor to work with this team. But what you will find in this report is it is incredibly timely. I know I'm going to touch on it in some of my slides, and I know that Serge, José, and Pedro will as well. We are at a pivotal moment globally where we have global aging populations, we have a revolution in diagnostics around Alzheimer's disease and dementia. And we are also on the cusp of treatments, drug therapies that are breaking through, which effectively is changing the entire position, absolutely for people living with dementia or Alzheimer's disease and carers, but also for governments and healthcare systems globally. So the timing, Claire, was absolutely poignant for us. 2021 is the perfect moment to bring this report out.
So let's go into some of the key highlights that the report summarizes.
Sure. What I will say is this is quite a big report. Please do not attempt to read it all in one sitting, and please dip in and out of it. And the McGill team have done a wonderful job in highlighting which parts are very specifically appealing to different audiences. So let me give you a couple of those headlines. And this really helped us yesterday to draw some very, very high profile media attention as well. But globally, we estimate that 75% of people with dementia are not getting diagnosed. That's 41 million people based on the current WHO projections. That's an incredible, incredible figure, and is our call to action. That's our motivation. That's what we are here to do, is to change that.
What would be the, I have to ask you, sorry, why is that?
Ultimately, diagnosis is what unlocks all of the planning and the preparation that can come after that point. But whether that's medical treatment, care planning, lifestyle planning, further risk reduction, etc. But until you can get to a point of diagnosis, much of that information and much of that unlocking is inaccessible. And when you look at that at a global level, and for example, when you break that down into other areas around the world, that non-diagnosis rate is as high as 90% in lower income countries. Imagine 90% of the people living with Alzheimer's disease or dementia not getting to the point of diagnosis. It's absolutely incredible. Perhaps underpinning it all for us is it should be, and it's one of our calls to action, a human right. Everybody should have the right to a diagnosis. And if you were to ask yourself the same question by looking at another disease group, something like cancer, and say that 90% of people were not getting access to a cancer diagnosis, I think that there would be global uproar. And I think that's what we need. We need to speak much more loudly about this inability globally currently to diagnose. Please don't take it all as a pessimistic picture, because there are some very good examples globally as well, countries around the world that do this process reasonably well, but we must learn from them and move them forward. But Claire, let me just link those two first images if I can. There's definitely an inverse relationship, where you see countries from around 60% in high income countries of non-diagnosis rising up to 90%. And that needs to be leveled up as well at a global level. And the final infographic on this particular slide, 55% of people in one of the 3 surveys we did, and I think Serge will tell you a little bit more about the surveys, were given inadequate information at the point of diagnosis. Now, that in itself is incredibly frustrating and raises so many different questions. But it's also poignant to mention that that moment of disclosure, and I think José is going to talk about this, is also a very difficult moment for everybody that's involved in it. But the fact that 55% of people are not getting adequate information to take away is really, really poignant. And let me flip it for just 1 second. We asked Alzheimer and dementia associations all across the world how many of them are regularly updating information on diagnosis on their resources, and 98% of them are. So there's definitely a breakdown there, and signposting for clinicians is a really, really big step that we need to advocate for. So stigma, it underpins so much of what ADI still does in terms of our awareness raising. But let me just share a couple of these with you. So 47% of people living with dementia and carers identified a lack of trained clinicians as a barrier to diagnosis. And concurrently with that, 45% of people living with a diagnosis identified fear of diagnosis and stigma as a major barrier. It's incredible. And I'm going to use the cancer analogy again. If you jump back 15 or 20 years, the stigma that surrounded cancer was also incredibly high. People would whisper it, or they would say the C word. Cancer has broken through that stigma barrier to a great extent. People are much, much more readily coming forward now when they show signs or symptoms. We need that also to happen within Alzheimer's disease and dementia to help break some of that stigma. And please look at the one on the right-hand side. In our survey, 33% of clinicians in the survey thought that there was nothing you could do about dementia, so why bother? That is an incredibly difficult slide to read or infographic to absorb. And it marries very closely to a survey finding from 2019 at ADI, where 62% of healthcare professionals were also found to have said something similar. And I think there's a direct correlation there, which is hopefully going to change. As new drugs come to market, we should see a dropping in that figure. But overall, that figure shouldn't be there in the first place. Now, let me, if I can, just share a couple of slides with you in terms of some of the recommendations. There are 22 recommendations in the report as a whole, so please do go and have a look at them. This first one is really poignant for us. So healthcare systems globally should introduce annual brain health checkups for the over 50s. In, again, the same way, I'm going to use the cancer analogy, that is becoming much more commonplace. We need that also to happen with Alzheimer's disease and dementia, that potentially you can start talking about this and catching this at a much, much earlier stage.
Chris, I have a question though. How do you have, or to one of the doctors, how do you have a brain health checkup?
Yeah, please let me defer to one of the doctors if one of them wants to come in.
I can give a first attempt at answer a complex question. One thing that may be possible is to go online and check the warning signs. Then you could have an annual cognitive test that's been properly validated for culture, language, and also a functional test, a list of questions about your daily life. Are you able to do things you used to do well? This still needs to be worked up, but you could get some kind of feel online once a year for how you're doing. And we gave examples in the report of some scales that are currently available, but it would need to be further validated for use by the public at large, and what to do with the numbers that are emerging. And just to finish on my remarks, there's a proposal for an algorithm-based use of these numbers. It would be for clinicians for now, but perhaps even for the public at large. Thank you.
Super. So Claire, it's a really, really important question. And I think our motivation here is that if we can introduce this into healthcare systems, it becomes much more accessible, natural part of any health checkup. You know, our brains are ultimately the most important organs in our body, and perhaps have been neglected so far in our healthcare. If I can, let me take you to a global level again, and that recommendation 2, governments globally must urgently start to measure and record diagnosis. This is a huge, huge failing on behalf of governments at the moment. The World Health Organization has set a target that 50% of governments should be recording at least 50% of cases by 2025. That target is so far behind at the moment, and this is why our call to action is very, very strong. And as I mentioned, getting to the point of diagnosis is what unlocks all the care and support that comes after it. But without that information, governments and healthcare systems can't prepare properly. It's absolutely vital that they start to plug that gap. And it links so well into the third recommendation here, this tsunami of demand. And it's what I was inferring at the beginning. You know, we have a globally aging populations, and right at this moment in time, we're experiencing this revolution in diagnostics and treatment breakthroughs. And these three things are coming together all at the same time. And I think it has shifted the conversation. For 15 or 20 years, ADI has been advocating to governments to prepare their healthcare systems. I think the conversation's now shifted from supply to demand. People are now demanding it, which means there's going to have to be an awful lot of catch up from healthcare systems. This one's very, very poignant for us. Governments globally must recognize the right to a timely diagnosis. It should and absolutely should be everybody's right to receive a diagnosis once they start down this journey. To deny somebody the right to a diagnosis, and again, let me make the analogy, if you translated that to another disease or another condition, people would be horrified if they were denied a diagnosis. One of our big calls to action from this report is to make that an absolute right for every individual. And the final one in my small selection is to further build on some of the innovation we've seen through the pandemic and COVID-19 period, including things like telemedicine. It is incredible, often under duress and under difficult circumstances, how we innovate as human beings. And we've done so again. People with Alzheimer's disease and dementia were restricted in terms of their ability to have face-to-face consultations, to see clinicians, to get healthcare support. And telemedicine and things like Zoom that we're using today have been able to plug some of those gaps, and that innovation should continue, but it should not replace. So it has to be a complement to it. And my final slide, please, Claire. This was really just to drive you to the URL for the website. Please do go and have a look. So alzint.org, and it's a /World Report. You'll see it there, and it is free to download. So please do so. Thank you so much.
We also have a link at mcgill.ca/dementia. You'll see a tab that says World Alzheimer Report, and it can be downloaded from our website as well.
It's my absolute delight to introduce Professor Serge Gauthier. I've known Serge now for a good number of years and had a wonderful hosting by Serge in Montreal a couple of years ago. Serge, I'm going to pass over to you to give this flavor, really, if you would, of the report.
Merci, Chris. So thank you for this opportunity to highlight some of the information provided yesterday on the worldwide webcast. My task was really to say how we did it in 6 months, essentially. And we took advantage of previous models used by ADI in past years, including expert essays, surveys, and testimonies. The expert essays was simply writing to people around the world. We reached 113 authors to write 52 essays about very specific topics that would be relevant to the 25 chapters that we put together. And one of the things that helped us to deliver such a high quality report is the willingness of people we asked to actually give us their thinking. And quickly, within 2 months, they wrote short essays in the order of 1,000 words with 10 to 25 reference. So that was very helpful. The surveys, we were lucky. We were able to put together relatively quickly a survey for clinicians. And we reached around the world, as I will show in a future slide, over 1,000 clinicians. A survey for persons living with dementia or people who've just or are going through the diagnostic process and their family members. And again, I'll show some numbers, how many people answered. And testimonies was something very special and important from a human perspective is the testimony from people who've been through the diagnosis and people who live with them. So 6 parts in the report. And as Chris said, don't try to read it all at once. But it was written for various different audiences, and each section is clearly written. This is for someone who's going to go through the diagnostic process. This is for a clinician. This is for a clinician with expertise. And I think we've reached to all the important audiences for that topic. The last chapter is very important. It's the future. And as Chris said, we're at a turning point in the history of diagnosing dementia with the availability of new biomarkers that Pedro will talk about. So these are some of the numbers from the surveys, over 1,000 clinicians from 108 countries. That's an important number. It's a very representative sample. Over 2,000 over 2,000 carers from 83 countries also answered, and Claire and I will refer to some of their answers that are really relevant for our summary today and very relevant for the report as a whole. And 101 out of 105 countries, Alzheimer associations answered the survey, which is really remarkable. So some highlights from the clinician survey. Everybody agrees essentially that you need to do a memory test, a cognitive assessment for the diagnosis of dementia, and to track changes over time. Some choices were given. What test do you use? And no surprise, the mini mental state examination or the Folstein and the Montreal Cognitive Assessment, the MoCA, were the most widely used worldwide right now. But everybody also made us aware that we need other tests to probe further into the cognitive difficulties, taking into account language, culture, education. And we were fortunate to have an example to offer, the test developed in Singapore by some of our research partners, a visual cognitive assessment test, and they gave us permission to put the entire test in the report. And the readers will see also other kinds of tests that they can try. So if you're a person interested in the diagnosis, if you're a clinician who wants to have good tools to make a diagnosis, it's in the report. And telemedicine was indeed, as Chris was saying, now part of clinical practice by necessity, but it's opening the door to assessments at a distance for people living in rural regions or hard to reach geographic regions. So some pictograms to complement what Chris was saying. Yes, of course, because of COVID, 90% of the clinicians said that there were delays in person-to-person assessments. So we think there's a backlog now of close to a year for assessments in person for people with early symptoms. Time pressure, no surprise, clinicians who work with 5 to 10 minutes per person, it's not sufficient to do an assessment in someone with symptoms suggestive of dementia. So they have to bring them back and set aside more time. This is an approach that's been promoted by Ken Rockwood in Halifax, where even in family practice, if you see someone who clearly has cognitive impairment, you don't have enough time at that first visit. Just go for the essential, look for delirium, make sure the drugs are not causing some kind of intoxication, bring them back quickly for a longer assessment time, and perhaps make use of allied health professionals. Nurses, for instance, in Quebec, in Groupe de Médecine Familiale, are trained to do the MMSC and the MoCA. And maybe they could also be trained to do some of the functional assessments and the behavior and mood assessments. Tsunami was mentioned, the perfect storm. So we have an aging population, more highly educated population who seek diagnosis. We will soon have simpler biological tests using just blood and new medications. So there'll be, we expect, a high demand in the next 2 to 5 years for diagnosis. Selected recommendations to complement what Chris was saying. So instruments need to be improved. Claire already asked about what can you do now for your annual checkup. Yeah, we have to work on this. But there is a sensitivity to culture, education, etc. Yes, we were a little concerned that there was false information online. It was not such a big issue for diagnosis. Maybe it is. We'll talk about that next year, about management. And disclosure will be discussed by Dr. Morais next, but the message is loud and clear from the persons who've been through the diagnostic process. Please take time to explain to us what is dementia and what to expect in the near future. Claire will touch on that a bit as well.
Yeah.
So it's now my pleasure to ask Dr. José Morais to present his information about the report.
Hello, everyone. I'm very pleased to be here to talk about a component of this Alzheimer's Disease International Report 2021. And this section is dedicated to the disclosure of the diagnosis and the role of the physician. To start with, the diagnosis of dementia is a clinical one because it depends on the history one obtains, as well as a physical examination, a neurological examination more specifically, and also cognitive assessment using different tools and imaging of the brain. So with this, we get enough information to make the diagnosis. But some of the cases are very complex and the diagnosis cannot be obtained so readily. And physicians at that stage should say the diagnosis is not yet clear, not to give false hopes or even make a mistake on the diagnosis that carry great consequences. And in fact, it is the majority of the cases that there is a follow-up visit to the first encounter. We surveyed both physicians and people living with dementia and carers. And here in this graph, we are disclosing the results from the carers and people suffering from dementia. And 90% of them do say that they had a follow-up. About 45% of the cases, the follow-up took place between 2 and 6 months. And clearly, there is not a lot of difference between low-income versus high-income countries. In this first encounter, many aspects needs to be considered because in the first encounter, it is the responsibility of the physician to really see clearly if the diagnosis is present, but also in the middle of many other pathologies. And this is the case in the older population who have in average 3 to 5 chronic diseases. This brings about some challenges in the diagnosis. Also, there is conditions that can give a picture similar to dementia, but these are treatable. This is the case of metabolic conditions such as hypothyroidism, mismanaged diabetes, low B12 deficiency, even mood disorders with depression can mimic dementia. Occasionally, a very rare brain tumor can also happen. So with such a challenge and the limitations of time allowed to make an assessment, we realize that can be very challenging for physicians to make the diagnosis in the first encounter, which justified the need for follow-up. Other difficulties in the first encounter is also the recognition by the person living with dementia to recognize the deficits. There's a medical term for that we call anosognosia, which signifies lack of awareness. And this comes from the difficulty the person has to do self-reflection in her own or his own deficits. When addressing mentioning the diagnosis, it is both for the person living with dementia as well as the caregiver, because they make a dyad that is a very much needed effort between both in order to go through a disease that progresses over time. So the physician needs to explain with, I would say, a lot of sensitivity, because the diagnosis carries a lot of consequences. And occasionally we observe what we call a catastrophic reaction, which is a reaction due to being overwhelmed by the understanding of the diagnosis. physicians need to be very supportive when such a reaction takes place, and use also the presence of the carer to support the person who is implicated in the diagnosis. Of course, it is the responsibility of the physician, the clinician, to discuss the management of the dementia, both in terms of treatment for cognitive impairment, as well as other aspects of the disease that includes non-pharmacological approach. This aspect of management includes also referrals to home care, as well as the different associations throughout the world. It is important that the person and the family understand that the disease is a chronic disease that go through a process, through a stage, different stages where the challenges can change. And obviously, there is a need to discuss safety issues, the risk of wandering or the risk of falling, and this is important for the safety of the person. And finally, at the earliest stages, it's good to plan the legal, wills and mandates and all other legal aspects, because eventually the person could lose the capacity to decide. And as previous said, the need to refer the person to appropriate community resources and associations is an important component of the responsibility of the physician. Finally, I would like to mention that in the report, it was mentioned that we physicians carry our own stigma. Already have been mentioned that 30% of physicians feel that there is no treatment, which is wrong. We can always assist. If you cannot cure, you can contribute to the health of the person. Plus, some of us might have different approaches for sex, gender, different ethnoculture communities. And for this reason, we have to be aware of this and employ what is the evidences to treat persons. This is my last remark, which is that we clinicians must ensure that the person living with dementia and their carers receive the best available care and support. Thank you. It is now my pleasure to introduce you Dr. Pedro Rosa-Neto, Professor of Medicine Neurology at McGill University and current director of the McGill University Research Center for Studies in Aging. And he will be addressing many new aspects and the turning point of treatment for Alzheimer's. Dr. Pedro Rosa-Neto.
Thank you so much, Dr. Morais, for the presentation. Thank you for the opportunity to provide my impressions about the World Alzheimer Report 2021. I think one of the first messages that I would like to bring relates to the causes of dementia. So dementia is a clinical diagnosis that is caused by a number of underlying brain diseases. Research has shown that these disease processes start many years before the dementia symptoms. Such diseases may affect the brain blood circulation, preventing the arrival of nutrients and oxygen to the brain, or can be a result of an abnormal protein that instead of being eliminated by the brain, accumulate, reaching toxic levels, or either both. Importantly, these disease processes typically have a long silent phase where the disease developed without symptoms. Therefore, one may say that one can prevent dementia by halting the disease processes before the emergence of dementia symptoms. So regarding the brain scans and labs, they are very important. When the healthcare professional makes the diagnosis of dementia, it's very important to rule out treatable causes of dementia. That can be, for example, a brain tumor that can be misdiagnosed as dementia. It's also important to realize that dementia has multiple clinical presentations. Even patients with Alzheimer's disease pathology that I'm showing here in this figure the symptoms of the disease may show diverse clinical presentations. While most of the patients, they have a typical presentation characterized as memory deficits, others might present problems related to behavior, language, even the ability to execute acts. That happens because the toxic proteins that cause Alzheimer's disease might deposit in brain regions associated with language, behavior, or motor areas rather than memory regions. Regarding to age of onset of the disease, it's very important to bear in mind that dementia can also affect young people, and this is called young onset dementia. It can be secondary to Down syndrome, for example. However, there are other causes of young onset dementia, and it might happen in families, and deserves to be systematically investigated in order to rule out reversible dementias or genetic conditions that requires special care. So this regards to biomarkers. The scientists are working very hard to create tests able to detect the underlying causes of dementia at a very early stage. Early detection by biomarkers bring the hope of early therapies to stop the disease that causes dementia. One of the most important critiques related to the use of biomarkers in clinical care regard to the costs, because they involve expensive brain scans and lack of therapies for most of dementing diseases. Recently, development of biomarkers allow brain diseases to be diagnosed by using a simple blood sample. This brings the hope of early diagnosis at large scale in early interventions designed to stop the progression of the diseases in the brain. So now I'd like to introduce my colleague, Claire Webster, the founder of the Dementia Education Program. Please, Claire.
Thank you. And what an honor for me to have been invited to be one of the co-authors of this report. I think in my journey, this has been really probably one of the most epic and emotional moments for me to speak yesterday at the World launch and share my story. And my role with this report was really to provide the lived experience as a former carer, and make sure that that this report was also very accessible and readable by lay people like myself. But it was really my journey that led me here, and in this report I share my full story of all of the challenges that I had faced as a carer along the way. And I do not feel that my story is any more difficult or challenging than anybody else. I'm just a person that has chosen to be very public about what happened to us, my mother and I, with the hope of sharing my experience with others and talking about the importance of education. So what really led me to do the work that I'm doing are the words that I received, the prescription of care that came from the doctor, which was "Good luck, Mrs. Webster." That was basically it. In 2006, when my mother was diagnosed with Alzheimer's disease, the neurologist, those were the words that were provided to me. And what I've realized throughout the years is that, should I have been provided with some type of proper information, education, it really would have had a much more positive impact, on my mother, on myself, because a lack of education really has a significant impact on the quality of care, the choices that we make, the way that we communicate with our loved one, and on our own safety, our own well-being. And, this is a disease that has a ripple effect, not only on the individual who is diagnosed, but it has a ripple effect on everyone around them. So education is really, really key. And so as part of the World Report and the survey that we did, one of the questions that we asked, the carers and the persons living with dementia around the world was, what was the biggest difficulty that they encountered upon receiving a diagnosis? And no surprise was really the lack of information that they were provided by the clinician. And Chris, when I look back at one of the first slides that you discussed, and how, 33% of clinicians who responded saying, why bother giving an assessment since there's no cure? Reflecting on that, I've always said to myself, like, why are people not provided with information? Like, why? If you were diagnosed with heart disease or cancer and other illness, you would never leave a doctor's office without the proper information or plan on what to do next. But, I think that the survey clearly highlights, if that many doctors say, well, why bother? Well, then there's an answer of why bother even providing any information, right? Because there's nothing we can do. So good luck to you, And, when we look at the comments from the thousands of people who responded, we had a lot of carers write to us the words of good luck, see you in a few months, take care, were really what was coming loud and clear. So, the disease is so incredibly complex. It's a disease that is ever evolving, that doesn't only involve cognitive changes, but it involves physical changes as well, that families really, really need to be prepared. There is so much information, education that has to be done. And, in chapter 16, which is the chapter that I wrote, I really talk about some of the guiding principles that need to be taken into consideration upon receiving a diagnosis, and for which we will be going into great detail in the WAR 2022 next year's report. But if there's anything that I can say and that I really learned from having had the great opportunity to be a part of this report, is I highly recommend to everyone listening today, whether you're not there yet, or if you're interested in dementia, or you've just received a diagnosis, is really devour this book. Devour this book, because you are going to learn so much. And there is an entire chapter also devoted to preparing yourself for that first doctor's appointment, right? One of what I've learned from this process is I arrived at the doctor's appointment with my mother, not prepared, not knowing what to expect. And I did not have a list of questions. And, we talk about time. So, one of the challenges of diagnosis is that, especially primary care physicians, they don't have the time necessary to sit down and spend the hour that it would take. So as a carer, or as a person who is concerned about their own health and well-being, you need to be prepared. So if you understand the questions that need to be asked, you need to arrive at the doctor's office with those questions, arrive with your medical history, arrive with those medications that you're taking, or other existing health conditions that could be impacting, some memory issues. But be prepared. And this is what this report is going to teach you. It's going to teach you what you need to expect, as opposed to sitting there and not knowing what questions to ask. So that's my most important takeaway. We also discuss in chapter 21 the impact that COVID had on carers and on people with dementia. We hear, especially in Canada, how the majority of people who passed away in the long-term care facilities were those people who had dementia. So there's a chapter devoted to COVID. We also talk about the evolution of telemedicine. How many people are now, we're fearing going to the doctor, going into hospitals for checkups, fearing going to the doctor's office, with the evolution of telemedicine. But as Dr. Gauthier highlighted, as much as telemedicine has its opportunities, it's really important as much as possible to see the doctor in person and have a true physical assessment. So, as a team, and everybody could jump in on this one, next year's report is really going to be focusing on the post-diagnostic management and support, what we call a prescription of care. We're going to go through the various stages of the illness and really what to do, how to plan, how to be one step ahead, what are some of the pharmacological and non-pharmacological approaches, to manage this illness. And we also, Dr. Rosa-Neto his expertise is also in the field of early onset dementia that affects people under the age of 65. So we're going to talk about the impact on young carers, because we often think of a caregiver as somebody who's older, but there's a large population of young carers from as young as 12 to the age of 25, when we say those developing years where they're going to school and they're going to university or just beginning their lives, where unfortunately a parent is diagnosed with dementia, and they have life just becomes completely changed for them. We're going to talk about caregiving customs and challenges among various cultures, because the definition of caregiving in one culture doesn't necessarily mean it's the same definition in another culture. So we're going to be addressing that, and we are going to be doing a complete analysis of the curriculum of various medical schools around the world, understanding what is being taught to the medical students upon, what are they telling the person being diagnosed, what are they talking to the family members, what is being taught, not only with regards to prescribing medication that may or may not work, it's how are they talking to people about how to manage dementia, which is going to be very important. And then we're going to talk about, which is an area that Dr. Morais is very, very an expert in, is in preventing cognitive decline. A lot of people, because of the growth of dementia, the rates, how can we prevent? What is the latest research that is coming out? And then most importantly, what are the government strategies and policies around the world to support persons living with dementia and their carers? One of the biggest challenges, I think, that in addition to lack of education about the illness that people face, is really the lack of information about how do we navigate our healthcare system in our country? How do we get support when we need it? What is the difference between public health versus private health? I know that, for instance, in Quebec, people do not understand the role of the CLSC, or what is a CHSLD, which is a long-term care. How do we access this? So we're going to be discussing, the complexity of healthcare systems around the world. Well, I'd like to thank all of you for coming on McGill Cares today. I mean, what a report! And Chris, any final words on this report and what's to come in the coming months with ADI?
Yeah, of course, Claire and my fellow panelists, what an absolute pleasure to be able to share the findings of this report again. For ADI, our work continues immediately. I mentioned that we work very closely with the WHO, and we continue to do so. Perhaps as the pandemic begins to ease, we will be able to get back to face-to-face meetings with them. But Canada is a really good example of a country that has a national dementia plan. It had a very thorough process in its development. It's one of the exemplar plans. But for 80% of countries around the world, they still do not have that plan. So ADI's focus going forward is very much going to be on that. A couple of very quick things as well. We are hosting our global conference next year. We're going to host it from London in the UK. However, it will also be online as well. And a big part of that program will be about this report and the next report. And our program is very open to people living with dementia and carers. So please do consider joining us for that. And one final thought from me is, Claire, you touched on this yourself. The position of ADI as the global body means we are constantly able to share incredible examples, both good and bad, but really inspiring often case studies from around the world of people that are going through this, that are experiencing this. And if you sign up to our newsletter, we will be able to get that information in front of you as well. And genuinely, to take inspiration and advice from every corner of the planet really can influence what you do within your own circumstances and within Canada itself. So a big thank you from me for your time and for inviting me to this webinar.
Well, thank you to all of you. How fortunate am I to work with such a great team of doctors and great team of men. I'm still so emotional from yesterday's launch. So please join us on our next episode of McGill Cares, which will air on October 6th. And my guest will be Dr. Dawn Dole, who will be talking about understanding responsive behaviors in people with dementia. This webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. If you would like to make a contribution to our program or for more information, please visit us at mcgill.ca/dementia. And if you would like to sign up for our newsletter and be informed of all of our initiatives, please write to us at dementia@mcgill.ca. I also really love to hear from our viewers and your personal stories, so please don't hesitate to reach out and write to me. Thank you for watching.